If you think acne and acne scarring is just a cosmetic issue, think again. Acne scars don't just leave a mark on your skin, they can leave a mark on your confidence. And that is why I am so passionate about helping people with their acne, A, to prevent acne scarring, or secondly, to treat the scarring that occurs from acne. I have so many patients tell me they don't even really care about getting an acne lesion because they know it'll be gone in a week or two. But what they care about is the scarring, the discoloration, the redness that lingers and lingers. I'm Dr. Mina. Welcome to the Skin Reel. On this week's episode of the Skin Reel, I'm joined by international dermatologist and acne scar expert Dr. Mehrnoosh Heidarian, and she is going to break down the real science behind acne scarring, the latest treatments that actually move the needle, and why it isn't just about aesthetics. It's actually about healing from the inside and externally. If you are dealing with acne and acne scarring, or you just want to understand what your options are, this episode is for you. Dr. Heidarian, thank you so much for joining me. You are an international lady. I met you in the US, you practice in Iran. Now you're in Canada. I'm so glad I was able to grab a few minutes of your time to talk about something that is really important and I think under discussed, and that's acne scarring.
Thank you so much for having me on. I'm so honored. Yeah.
You're really an expert in this, right? And can you just tell me, why did you decide to focus on acne scarring?
It's been over 20 years. I'm practicing as a dermatologist, and my field of interest is acne scar. I have done different procedure on a patient with acne scars, maybe thousand of patients during these days. And the reason I love this field is that the result is very super rewarding. It's not just about treating acne scar. It's about treating the emotional impact with acne scar. When I see my patients seeing they're smiling at the reflection in the mirror, and that's the best moment for me. It's super rewarding. That's why I'm very interested in this field, in acne scar treatment.
You hit the nail on the head. Acne is not just a cosmetic issue, right? Even though acne treatment is medical, at least here in the US, but the scarring's not. And I just saw a patient yesterday for acne, and he was getting a little bit of scarring. And he was surprised when I was mentioning some of the scarring. And I said, we really want to get a handle on this before your scarring worsens. And he was like, oh, the scarring doesn't go away. And I was like, no.
Because the acne scar is pretty common. As you may know, 95% of acne patients develop acne scar at some point in their lives. And in general population, according to the studies, 10 to 15% of people develop acne scar and are affected by acne scar, and which is very stubborn and challenging when it comes to treatment. And that's why it has an emotional toll for the patients with acne scar. And when you achieve the optimal result, it is incredibly rewarding for both patients and practitioners. And that's why I'm interested in treating acne scar.
Yeah. No, I'm so glad. And I find them very challenging, right? Like acne scarring, or it's not just like one size fits all, right? There are different types of acne scarring, and I'm sure you'll go over that. Yeah, why don't you sort of tell us what are kind of the different types of acne scarring that we see?
And when you help them, the people struggling with acne scar, it's like help them restore their self-confidence, self-esteem, and also quality of life. It's not just about treating acne scar, like I said before.
Yeah, no, I totally agree with you. It's not just a vanity metric, right? And there's studies to show that people who have acne, or the sequela, right, the consequences of acne, people view them as less intelligent, less likely to want to be friends with them, right? So there is this like isolation and loneliness and consequences in your life based on this, which is sad. But thankfully, there are people like you who are really promoting ways to treat the scarring.
Yeah, that's so true. Thank you.
Well, tell us a little bit about the different types of acne scarring, right? Because it's not one size fits all. There are different types of scarring, and probably if you're listening, you may have heard of ice pick scars or boxcar scars or rolling scars, right? Like, can you kind of break down the difference between those?
We classify the acne scar to different types, depend on the shape of the scars. Acne scar caused by inflammation of acne. When inflammation happens, it disrupts the collagen in surrounding the skin, and the skin is, automatically start repairing itself. And any unbalance in healing process may cause acne scar. Less collagen leads to atrophic scars, and too much collagen leads to hypertrophic scars or keloid. In atrophic scars, we see depression or dentation on the surface of skin, and it has different types in shape, including boxcar scar, rolling scars, or like M shape. Boxcar scars like a square shape or U shape. It's better to say that U shape, and ice pick scar or V shape. And hypertrophic scar or keloid scar is caused by excessive collagen, and it's raised like a flesh color raised on the surface. And we also have pigmentary changes. They are not true scars. It has some emotional and psychological impact on for patients, and that's why they are grouped as a acne scar as well. And they include, such as PIH or post-inflammatory hyperpigmentation, which happen mostly in darker skin tone, and PIE or post-inflammatory erythema. It is a redness, which you're seeing mostly in fair skin, and post-epidermal pigmentation, which happen by pigmentation mostly in epiderm, which is less commonly used. Then pigmentary changes like PIH or PIE are classified as a acne scar as well, and depend on the depth of a scar, shape of a scar, distribution of the scar, and even the distribution, the location on the face. We customize different, protocols and treatment plan based on patient skin color and expectation. You have to talk to your patient. You have to have a conversation in consultation session to see, to understand, their aesthetic goals, their expectation, their recovery time, their budgeting, and depend all those factors. I'm as a dermatologist can design a treatment plan based all those factors. It's like a treatment plan tailored to each patient. Like you said earlier, we don't have a approach like one size fits all. Nowadays, we have so many tools and technique available in the market, and which is so amazing. And we can combine all those tools and techniques to create customized treatment plan for each patient. And that's a huge evolution in this industry.
Absolutely. I love that. I love how you broke down the scarring and to include things like the pigmentary changes because I have friends who will say, I don't care about getting the acne because I know that's going to go away in a week. But what I hate is that it's going to leave this brown spot on my face for the next 6 months, right? Like that's the frustrating part. And then I forget this too, but I'm glad you brought it up that keloids and hypertrophic scars happen from acne. I see this a ton in patients on like the chest, the shoulders, the back, where they had acne.
Chin, jawline.
Exactly. Especially seems to be like male patients a lot. And they just get those thickened keloids, right? Or thickened scars. And that's certainly common as well. What are some of your go-to treatments for that pigmentary changes, whether it's the hyperpigmentation in someone maybe with darker skin or the erythema, the redness in someone with lighter skin?
When it comes to PIH, it's very challenging. And when as a dermatologist practicing in Tehran, we have a wide range of variety of skin type, 3 to 5. And I have to very, very conservative to treat a skin of color. And I have to always consider the risk of PIH. And when it happens, I prefer go for medication and topical therapy, not energy-based devices, because it may cause worse the PIH. It takes time, but when you recommend your patient like restricted photo protection and chemical peeling, like a very superficial chemical peeling or topical therapy, and it helps them to get rid of the PIH very faster. When it comes to treatment of skin of color, I prefer the very slowly improvement of PIH or any pigmentation rather than go for achieving faster results or rush to getting the immediate results because it's fire back and it make it worse.
I'm glad you brought that up because people can be so anxious, like, please just make it go away, right? But if you are using energy based devices, there is heat. You aggravate the skin more, then you're going to worsen it. So I'm glad you brought that up.
Yeah, and even if I go for energy-based devices like laser or something, I tend to favor non-ablative laser or energy-based devices with very conservative setting. I start with low and then gradually build based on patient skin response and tolerance. But this is not my first line treatment. I prefer, topical medication and restricted for the protection first.
Yes, yes, all of that is super, super important, and of course, making sure the acne is under control, right? Like, there's no point in treating acne scarring, right, when there's still active acne going, that can lead to new scarring, so that's a great point. Now, what about? Because I know you do amazing work with the more atrophic scars, right? So, how do you approach a patient with their acne's clear, they're not getting any new breakouts, but now they are left with some significant scarring and they want treatment. How do you approach that?
For atrophic scar, like I said, it depends on the shape and depth of the scar. They have different shape, and maybe your patient has different types and different shape and different depth of acne scar. It all depends on patient skin condition and skin color. And then I go to create or design a treatment plan. If for some procedure like subcision, it doesn't matter the patient have active acne. You know what I mean? But if a patient comes to my office and seek the treatment with active acne and also different shape of atrophic acne scars, I prefer to clear the skin first to see what is it behind, and then decide to choose which device or which procedure for the patients.
Yeah. What is subcision in case someone listening isn't familiar with that?
Yeah, subcision is a minimal invasive, it's just a small surgery, like a minimal invasive procedure, which is a small surgery. In traditional subcision, it is needle assisted or cannula assisted. We use a very small needle, go beneath the skin and break the fibrotic band at the bottom of the scar, release the tetra skin, and help them elevate towards the surface, which leads to immediate results, make it more invisible. This is traditional subcision or former subcision. But in my signature technique, you may know, I use laser assisted subcision.
Yeah, what kind of laser?
The laser is diode with wavelength of 1470 nanometer, which is the gold standard for water and fat absorption. And we don't use cannula or needle. We utilize micro-optic fibers, especially for radial fibers, which deliver the energy of laser beneath the skin, somewhere between the dermis and superficial subcutis. It has many advantages because the laser is working well below the DE junction, meaning that the PIH or post-inflammatory hyperpigmentation is unlikely to happen. Of course, if performed by a very well trained and experienced practitioner. And that means that this procedure is safe all year round for all skin types, and no photoprotection, restricted photoprotection is required like other laser procedure.
Very cool. So all skin types can get it. Do you numb the area? Do you use topical numbing, or do you have to do, local numbing with lidocaine?
It's a full numbness is not required in this procedure. There are virtually no downtime and just a few days of swelling. And the reason we don't need full numbness is a, the laser target water inside the tissue. And if I inject any solution like lidocaine, it's gonna absorb the laser of energy. It's meaning that it's a waste of energy and the laser is not going to working effectively. And B, we need a guide. We need a feedback from the patient as a guide to avoid us to entering the danger zone on the face and leave any nerve damages. As a practitioner, start of practicing endolift, you need to know the anatomy of face, be familiar with danger zones, biology of skin, tissue laser interaction, all together to get the optimal result and avoid any complications and unwanted side effects. And that's why we don't need full or complete anesthesia. Plus, it is office-based procedure. You don't need clinical setting. And you can also combine this laser assisted subcision with other treatment modalities like ablative laser, non-ablative laser, radiofrequency, flare injection, and similar treatments to achieve more desirable results. And moreover, like I said before, in traditional subcision, we use a needle or cannula and we mechanically disrupt or break the fibrotic band, but in laser assisted subcision, you do it by laser energy. You get it done more effortlessly, which is user friendly, for the doctors, for practitioner. And also you achieve the better results only with single session of treatment compared to the traditional one. And the recurrence rate with traditional subcision is higher compared to laser assisted subcision.
Yeah, it's definitely an advanced technique. I have not personally tried it, but I am a big fan of subcision for any kind of scar, acne scar. I actually did it. I have a little scar between my eyebrows. I did my own subcision. Cellulite, I imagine, can you use this for cellulite treatments?
Yeah, it can. Actually, the device is Lasmar 1500, manufactured by Photo company from Italy. And this device is FDA approved and FDA certified for laser assisted liposuction and is originally created for skin lifting, skin tightening, and even face contouring and fat removal when necessary, when needed. And my idea to create this new approach for treatment of atrophy acne scar was born from my passion to help the patient struggling with acne scar and also my drive to think outside the box. However, it was originally created for face tightening or skin tightening. I saw its potential beyond that. I saw its potential to use it differently. And you are not gonna believe that. It's become like a game changer in my practice over the last 7 years.
Amazing. Very cool. I love that how, yeah, things that are designed for one, once you start using it or understand the mechanism, you're like, wait a minute, I can use this for something else. So very cool. What about other energy-based devices like radio frequency microneedling or lasers like a ablative or non-ablative laser? What are your thoughts on those for scarring?
They're effective and I can combine all those tools and different technology all together to get the optimal results. Every tool works, but for tethered scars, for severe fibrotic scars, subcision, either traditional or laser assisted subcision, is non-negotiable. I go first for that one. And then add other techniques and technology. Depends on the alteration in texture, pigmentation, or, laser assisted subcision has a consumable. And I don't use this procedure for treatment of just a localized area with a few isolated different scar because, the cost benefit ratio is not favorable. And it doesn't work for very superficial scars as well. I choose this technique for medium depth to deep acne scar, rolling a scar, box scar, but not ice pick scar. And also, I use this for mature acne scar patients because with aging, we have sagging, especially in mid face and lower face. And any sagging skin or laxity can exacerbate acne scar. And what is most exciting about this technique is that this technique tackled both acne scars and skin laxity at the same time. And even if no acne scar exists in vertical vectors, I added intentionally this vector for this procedure to have the lifting effect because lifting effect can make the acne scar more invisible. When it comes to acne scar, we don't aim perfection. It's not going to happen. What you're trying to do is make it invisible.
Yeah, I do a lot of surgery too, and I have to tell people, anytime we cut the skin, there's going to be a scar, and I can try to hide it, make it as nice as possible. We have tricks that we can do afterwards, but there will always be a scar. But our goal is to make it as hard to see, as invisible, right? But truly, truly looking, you will probably still see a remnant of a scar, right? So I think, yeah, again, that expectations that it's not gonna be 100%, but we can significantly improve this.
Yeah, that's what we aim for. Significant improvement, not 100% cure.
Right. Yeah, it's important to know that because then you'll be disappointed, but we can certainly improve them. Let's talk a little bit about ice pick scars, which it's kind of a disturbing to think of, but like think of an ice pick and like going like this on someone's face. So you have those sort of deep small punctures really in the skin. Those are ice pick scars. And yeah, I agree. It takes a different approach, right? What's your go-to for ice pick scars?
I usually go for cross technique.
Yeah, tell me about that.
Cross technique, is kind of chemical peeling, and the substance is TCA or trichloroacetic acid. And I go for like a 70%, minimum to 70%. Start with 70% concentration. I use a pick to put the TCA in the bottom of a scar. What it does is stimulate the collagen production, and it needs a series of sessions, 4 to 6 weeks apart. And I recommend this treatment in not in summertime, like in the autumn or in the winter, because it requires a stricter photo protection. Otherwise, they ended up with PIH, especially in my area in Tehran. Like I said, we have a wide variety of skin type from skin type 3 to 5, and then I have to be very careful and mindful to choose the devices or any device setting or any technology when it comes to treatment of acne scar. And chemical peeling is one of those I should be very careful.
Yeah, normally you would never do that strong a TCA peel in someone with a skin type 3, 4, or 5, probably, really. So, do you worry? I mean, because it's such a strong peel, do you worry about using that in darker skin types, or is it because you're being so precise with where you place it? It's okay.
Actually, both of them. Precision is needed. And when it comes to treatment of the skin of color, you should be very, very conservative and start with I don't go for aggressive or high energy one treatment session. I prefer multiple gentle session of any treatment.
Yeah, playing the long game, right? Is what I tell my patients.
Exactly.
Absolutely. What about just boosting collagen, right? Because we know as we age, the loss of collagen, it can make the scars more noticeable. How do you address that in your patients?
It depends on the age of the patient. I told you in mature acne scar patients, like the people who are between early 30 or to late 40, we have a skin laxity component as well, which can exacerbate acne scar. And beside the acne scar revision, I recommend some skin tightening device as well to address a skin sagging and the skin laxity component. And any sagging like skin, like I said before, worsen acne scar appearance. Then it helps. You address it, at the same time, scar, and also skin laxity.
What about things like biostimulants, Radiesse, Sculptra? Those are the ones we have here. Or even fat grafting. Do you ever do that underneath the scars or in addition to your other treatments?
From my experience, I'm not very interested in fat grafting or biostimulator, injection of biostimulator for acne scar. When it comes to acne scar, if I go for biostimulator like Sculptra or Radius, I prefer use the laser assisted drug delivery. I mean, go for resurfacing laser like a fractional SO2 or avion YAG laser, and then apply topically um, Sculptra already is on the surface, not injection, because it's already scarred down there, and there is a chance of development of granuloma. It may happen even if all those products are FDA approved, but it's inevitable. It may happen. That's why when it comes to biostimulator to treat the acne scar, I prefer to use it topically, not as injectable.
Yeah, using the laser or the device to create those little channels in the skin and then applying it on top. Yeah, amazing.
Yeah, you can use the ablative laser like fractional SO2 erbium YAG laser. But like I said, again, with low setting, with a low energy, and then apply the injectable, those products you said, like Sculptra or Radiant, mostly Sculptra on the surface.
Oh, we haven't talked about microneedling, and maybe this might be a more affordable option for someone who is not ready for the investment of laser assisted subcision or lasers. What are your thoughts on microneedling for acne scarring?
It's considered as a collagen booster device. There's no doubt about it. But we have microneedling radio frequency available these days, and my preference is that device because it got the energy beside the microneedle, and the recovery time is much better, and the results is more effective compared to microneedling. You need more session of microneedling to get the results compared to microneedling radio frequency. But it still works. Microneedling still works. But I prefer microneedling radio frequency.
What about those thickened scars that we talked about in the beginning, the hypertrophic, the keloids? What are your go-tos for that kind of treatment?
Usually, I go for vascular laser like PDL and steroid injection like analog injection or 5-FU injection. Depends on the, yeah. And keloid is very challenging. It's very, very stubborn, and it takes a the series of sessions. And I always tell my patient, even if it gets better, but there is a chance for recurrence.
Yeah, I usually say, we're going to see each other every month. With my patients with darker skin, I tend to use more of the fluorouracil, the 5-FU, or mix it with a steroid. Just I find I get a little less pigmentary changes with that. So always try to mention that too. It usually is reversible, but it can be a little disheartening when someone has a keloid and then now they have a little white spot around it. And then I will do a lot of excisions of cutting out of keloids.
That's good.
Yeah, the important thing to remember is you do have to follow up with those injections, or I will have them follow up and do radiation to the area as well.
Yeah, radiation. Yeah, yeah, they need the radiation after excision.
Exactly. Post any of these procedures, is there any sort of topical therapy you really recommend for your patients? I know sunscreen, right? But silicone is popular here. I really recommend tretinoin with retinoids, or do you recommend peptides, exosomes? Sort of, what is your post acne scar treatment topical regimen? Or say someone's come to see you for the subcision or they have laser. Is there anything you recommend after as the skin's healing on anything? And maybe you don't have anything you recommend, but I didn't know if you were like, "Oh, I love this peptide or exosomes or silicone."
Exosome as an injectable is available in Iran, but I never recommend it. I never recommend it, but I have not seen any like a serum or something as exosome available in the market of Iran. If it's available, I definitely recommend it for speeding up the healing process. It works, especially after microneedling. But as an injectable, maybe PRP as a something as a regenerative medicine, PRP or PRF are available, and I recommend PRP for especially after resurfacing laser like CO2 laser or erbium YAG laser. It really helps.
Just like rubbing it on?
Yeah, exactly.
Yeah, to help with the healing.
Yeah, immediately after procedure, rub the PRP on the face to speed up the healing. That's what I'm doing.
What about silicone? Here, I have tons of patients that after surgery want to do silicone gels or sheets. Do you find that's helpful at all for acne scarring?
Silicone gel and silicone sheet are available in Iran, and I recommend it for keloid, hypertrophic scars, not atrophic scars, but it can help. It can help and soften, it soften the keloid and prepare for other treatments, other procedure like vascular laser, drug injection.
Yeah, I do find it helps with the thickness and the pink of those thicker scars for sure. And then I'm a big fan of retinoids like tretinoin prescription strength. So I always think that's a powerful collagen booster that you can do at home. And it can also help with any discoloration. And it helps prevent, the comedones that cause acne, right?
It's like a jack for all trades when it comes to tretinoin. And also, it's like a gold standard for collagen production in skincare products. And you can recommend it as a maintenance therapy for acne patients or our acne scar patients. It really helps. It works at the same time on the active acne and acne scars, and also post-inflammatory hyperpigmentation. All of them.
Yeah. No, I'm always like that should be in your nighttime routine if it's if it's not already. I'm a big fan. Well, Dr. Haydarian, this has been a ton of fun. I have learned a lot about acne scarring and treatments. If you could just give anyone listening who is maybe struggling with acne scars, sort of your top 3 takeaways from this episode, what would they be?
As you know, there are so many misleading marketing these days on different platform of social media, especially on Instagram or TikTok, and tons of misinformation about skincare from non-professional or influencer on the net. It's spreading all over, and there are also the market is flooding with different devices. As a dermatologist, I always tell my patient, get your advice from a professional, not anyone you see on social media. Because I told you there is a misleading advertisement like there is a one solution, magic solution for acne scar treatment. Is acting like a silver bullet, and if you go for one session of treatment, it erases completely acne scar, which is not true. It's not a case. And I always telling my patient, see your treatment as a journey, because acne scar treatment is a healing process. It's a biologic process, and it takes time. It's not going to happen overnight. And you should be very patient, trust the process, and follow your dermatologist. And I always say that when you start your treatment, the treatment plan I created specifically for you, please follow me from beginning to end, and don't give up halfway. If you give up in the middle of the way, you're frustrated, and you will end it up with wasting time and money, and you won't get the full benefit of the treatments. But if you commit to the full course of treatment, the result will be truly life changing, and it helps you restore your confidence, esteem, and quality of life. And you can achieve the optimal results if you follow your dermatologist, trust the process, and being patient.
Amazing. I couldn't have said it better. And that's really why I started this podcast, is just to give people some factual information from true experts about their skin. So I love that. This is amazing. I know you have a strong presence on social media to help spread great information. I know people are going to want to find you and follow you. What is the best place for them to do that?
Thank you so much for introduction for my introduction. And but what I'm trying in on social media is to educate and inform my patients about the truth in cosmetic dermatology. And it's really rewarding. I have a lot of patients seeking the truth because, like I said, there's a false information spreading all over the net, and they make a false hope and false expectation. And you need, as a dermatologist, to set up a real expectation and not a false hope, because it doesn't work, neither for practitioner nor for the patient. And when it comes to treatment of acne scar, there are lots of misinformation out there, and you need to have a conversation, a consultation with your patient, talking about their real expectation and what it works for them. There's a huge evolution, tremendous evolution in industry. We have so many tools and techniques available right now, sophisticated and advanced technology. And we can combine all those tools and techniques to help our patients with acne scars. And there is not such a single tools to help them or erase the acne scars 100% or completely. There's no complete reversal. And they should know that, because they spend a lot of money for treatment. And if they have a false, hope, they will be frustrated, and their doctors also get in trouble.
Yeah, so important.
Yeah, and social media these days, working like a two-edged sword. It's a new technology like any other technology. If you use the social media to educate your patient, inform your patients before they seek help and come into your office, it really help both of you, practitioner and patient. If not, you get in trouble, because they already get tons of misinformation, and they're gonna come to your office with dream.
And also on social media, right, when people have these filters on that make their skin, look unrealistic, and then we start to think that's what normal skin looks like, right? And we forget that's not reality, so
Yeah, that's not true. It's not a reality.
where can people find you and follow you? What's your social media handle?
On Instagram, and my Instagram account is at Dr. Heidarian.
Perfect. I will include that in the show notes, and if you're in Tehran and you have acne scars or, skin concerns, definitely check out Dr. Haydarian's practice. What's the name of your practice?
I'm practicing at the cosmetic dermatology. It's a private practice. Thank you for promoting me.
Yes, amazing. Well, awesome. Well, I really enjoyed our conversation. I learned a ton, and I thank you so much for being here.
My pleasure. Thank you for having me on.
So I will see you next week.